Today I'm answering a question from Frederica. Let's listen.
Could a PRF treatment do the same thing as a fat transfer could do to the face?
Thank you for that question. Remember, in the more info below where it says show more, there's a link where you can ask your questions. She's asking, will a fat transfer equate PRF injections? Fat transfer, we harvest fat from a part of the body, usually say the belly. We process it. Sometimes we add PRF or a blood draw where we spin it down. You get platelet-rich fibrin. Many people know PRP better. I much prefer PRF. It's all natural. And then we put that back into the face. It's a great idea because it's all natural. You don't have to have anything synthetic. But remember, with a fat transfer, the thing is not all fat takes. In other words, it doesn't all live, meaning each individual fat cell needs its own capillary or its own blood supply to survive. Because of that, a lot of the fat dies off, but it does leave stem cells behind. Fat has 10% mesenchymal stem cells. A stem cell is something that can grow into other cells, skin, bone, other fat, different things. So, and it rejuvenates. So you get rejuvenation, you get some of the fat that comes back, but remember, we took the fat from the belly, it's gonna act like belly fat in the face. So estrogen changes, if one has more propensity to grow their belly fat, it will grow in the face more. So it doesn't always take, it's imperfect, you can have irregularities, but it is a good procedure for some that don't want fillers or biostimulators. The question is, can it equal PRF? Platelet-rich fibrin, we take the blood draw, we spin it down to get your own growth factors, mesenchymal stem cells, cytokines, we inject it back. Now the blood draw is way easier than getting a fat transfer. There's 1% stem cells in peripheral blood. The thing is, I can come get your blood 3 or 4 times a year, you don't care. It's only, we're taking 40 mLs max, maybe 50 mLs, small amount of blood, but I can then kind of add it up over time. I can rejuvenate it, the face or wherever we're placing it, and you don't have to get fat retaken if it doesn't look perfect. So there's positives and negatives, but fat will give you a more robust one-time hit because often we overfill with fat. Some people are real good with fat transfer, others aren't. So the take rates are anywhere from 30 to 80%. So they're very different. One's much more invasive, but neither of them can you say, this is the result you're gonna get. Here's the after picture you're gonna get. Because we're depending on your own body's regenerating factors and the amount that we put in to get the final result. So they're both somewhat imperfect. Why I do way more PRF and PRF gel, where we heat the blood product, is because I can do a couple sessions, 6 weeks apart, and then I can touch up as needed. Most people come in for PRF and gel products, where we heat that blood product, once a year after 2 sessions initially. So it's much more palatable. However, we can't use that in the buttock. You can, but it's just not robust enough. The face is a good application for PRF, platelet-rich fibrin. The buttock is much more well-suited for large volume of transfer. So those are some difference. Fat and PRF, while they share some similarities, they're used in much different ways, and patients may just not want their fat harvested to put in their face multiple times, whereas they're much more willing to get a blood draw. Watch my many videos on fat transfer versus PRF and PRF versus PRP. I hope that helps, Frederica. Stay tuned. Continue to ask me questions.